Well, welcome into CommonWell TV, where we're hearing from some of the top health IT industry experts and how their organizations are helping when it comes to interoperability. So let's go ahead now and hear from ADVault and their chief medical informatics officer, that is Dr. Brian Yeaman. And Dr. Yeaman, what has ADVault learned since its collaboration with CommonWell since it began?
One of the major challenges of what we do at ADVault is advanced care planning, but ultimately at the end of life, we don't always know when those episodes may occur or when that advanced care plan is needed. Most of those critical moments in our lives are not planned. So this may happen in Florida, or it may happen at home, or it may happen at your daughter's house 100 miles away from home. So whichever health system or hospital or emergency department that you may be receiving care at, having your advanced care plans is obviously a critical piece of your care and your wishes being known. Obviously, CommonWell is critical to the success of the interoperability and the portability of those advanced care plans. So just as important as your medical record, your medications, your drug allergies, what kind of chronic conditions you may have, that information is key in terms of providing your care, but obviously it's critical to have your advanced care plan move with that. So our integration with CommonWell is a tremendous win for our organization in terms of collaborating with all of the EHRs that are participating with CommonWell, but also a lot of the post-acute care vendors that are participating with CommonWell. So we view this as a tremendous win and enhancement for us and a win for CommonWell.
Dr. Yeaman, through your experience, what have you seen or come across from maybe outside of the industry, people having maybe some misunderstandings when it comes to health data exchange, some maybe misconceptions?
I think traditionally we viewed health data as something that's difficult to transfer, that's obviously intensely private, and I don't think that that's the expectation of the consumer and of the patient these days. They're familiar and comfortable with sharing their information, and so we need to be able to help facilitate their expectations. We need to be able to help facilitate their care. And at the end of the day, that is what we're doing with CommonWell. We maintain all the privacy and security requirements, all the HIPAA regulation, the consents, all that piece is taken care of. But by participating in a network like CommonWell, ultimately, who wins? It's the patient. And at the end of the day, that's what it has to be. We're going to have disparate systems. We're going to have different health systems. We have different payers. There's different places where people are receiving different kinds of care. And so you've got to be able to bridge the gap for all of their care needs across the facilities, and that's the patient's expectation. The days of patients bringing me 400 pages of their last 20 years of medical history that I can't pull the relevant information out of that in a timely fashion or in a way that best serves the patient. I do get that with CommonWell, advanced care plans, things like this that are critical and portable in terms of having the most recent one, having provider confidence that those things can be acted upon, all dependent upon real-time validated information. And that's what we're getting with CommonWell.
Yeah, the efficiency is not just beneficial for you, but it's beneficial for the patient, for the provider, and so on. So, Dr. Yeaman, if you were to explain to somebody what CommonWell is that is outside of the health information technology world, how would you go about explaining it?
Whenever I try to explain this to a patient, so I think that's probably by far the most relevant. Basically, it's a secure information exchange. And so I explained to them they can check their bank balance across different ATM machines. And it's really no different than that. It's a secure transaction that goes between two facilities that allows the relevant information that they need for their care to be transferred. And it's really nothing more than that. Unfortunately, healthcare relies upon the fax machine way too much still. And we've got to take a step beyond that so that the right information in a timely fashion can get to the providers to facilitate these patients' needs. And I think the one biggest frustration still to date of a lot of patients in healthcare is, you know, you show up at an appointment, the provider doesn't have the information they need from the specialist or whoever it may be that they've also seen, or the emergency department. And the answer to that is, well, we'll discuss it at your next visit. That doesn't help them today with their acute needs. And so at the end of the day, it's about better, safer care for patients. And that's really at the heart of all that we're doing. And I think that the CommonWell approach is really so important in terms of creating an equal balance in a fair way to share information across organizations and facilities that really, I think, cuts through the politics and cuts through some of the financial barriers, and does this in a way that's cost effective but delivers the care that people need.
Dr. Yeaman, as we can imagine, you've got your hands full right now with the COVID-19 virus. And what sort of strain is that really right now putting on the healthcare system?
Right now the challenge at this moment is around testing. It's hard to measure what you can't test for. And so the number of people that are infected is difficult to tell. We're trying to screen people at the offices. Have you done international travel? But the reality of it is that that virus is, you know, akin to the common cold in terms of its ability to spread rapidly, although its impact on the elderly in particular is much more profound. So, as healthcare providers, one, we have to be able to protect our patients and our facilities from being infected. So that's the first challenge. And then obviously the second challenge is those that do have the more serious version of the illness, how are we going to adjust our capacity and triage patients in an appropriate way that those who can be at home are at home, so that we're using our inpatient beds in a way that's um, effective for those that are the most ill. So the triaging of this is going to be tremendous. And that's, again, I think one of the ways that CommonWell is so vitally important. A lot of hospitals, I think, in the near future are going to be on divert because their beds are going to be full. So patients are going to wind up in different areas that they wouldn't commonly go to. So how are we going to do that in an effective way to make sure that we're delivering the patient's care? And one of the most important things about coronavirus that we're currently seeing is the comorbidities that these folks have. So if you have diabetes, or if you have underlying lung disease, if you have an autoimmune disease, how are you going to take care of those folks and understand their risk factors in order to risk stratify and obviously triage them and prepare for the appropriate level of care for that patient? You've got to have information to do that. So again, we need interoperability and record sharing in order to accomplish that. And I think CommonWell is a big piece of that. And then what we do at ADVault obviously is a huge piece of that as well, in terms of advanced care planning. And one thing I like to say about advanced care planning is this isn't all about death and dying. This is really critically important in terms of having a patient's plan known. So anytime you take a trip, you have a destination, and life's a journey. And we know that there's a destination at the end of life. And so being prepared for that is an important thing for all of us. And it's a critical thing to help families preserve their relationships, because we know many times at the end of life, it's miscommunications and misunderstandings and or disputes over what mom or dad would have wanted that ultimately lead to a lot of distress within families, and quite frankly, tear families apart. So again, creating this information, sharing this information, having it available when it's needed, because most of our events aren't planned. And in particular for the elderly at this moment, I think that this is, a really key thing that people need to understand. Having your record shared, using CommonWell, knowing that your records right now couldn't be more important because where you're going to receive care is really yet to be determined. And we're going to have to be pliable and flexible in how we deliver care as a healthcare entity and system for the United States. And having your advanced care plan is a big part of that as well.
And finally, here, Dr. Yeaman, if you could just maybe share a brief, maybe a note on our brand new executive director here with CommonWell, maybe one of those first initial meetings that you guys had, and what stands out and what excites you about his future leadership.
You know, what Paul was able to do in New York, and we had interactions through the Office of the National Coordinator as HIT fellows, and then obviously through some of the work we did in post-acute care and the Challenge Grant. I think it's a perfect fit for CommonWell in terms of understanding the methodology of the technology piece, the privacy security elements, but understanding the clinical workflows and the clinical patterns that are obviously going to make a huge difference for providers, for health systems, and for patients. So I think Paul's a great choice. And I think that his depth and breadth of experience and knowledge is really makes him ideal to lead CommonWell.
Well, Dr. Yeaman, I know that we are extremely happy to have ADVault aboard inside of the CommonWell Alliance. And for more information on them, ADVault and Dr. Yeaman, we invite you to log on to CommonWellAlliance.org. Thanks, Dr. Yeaman.
Thank you very much.